Okay. Mom, you ready? We good? Okay. All right, here we go, guys. Welcome, everybody, to the Mid-Level Show. I am your host, Ben Rogers, and I've got two really special guests with me today. They are new guests on the podcast, but very familiar faces in our offices. And up top here, we have Ernie Dickson, our physical therapist. He operates out of the Kingsport and Johnson City location. And down here, we got Katie Geagley. She is our operations manager for all of the offices. And if you've seen her, she's most often in the Kingsport, but she's been in all of them quite a bit. Guys, how is everybody? Ernie, how you doing?
I'm doing great.
Hanging in there?
Thanks a lot for having me on. Yeah.
Oh, we're super pumped, man. Katie, are you doing okay? I know you've been busy.
Yeah, it's been great to come on and.
Katie, can you hear me okay?
Excited to get to talk about.
Yeah, I can hear you now.
Okay, cool. Well, guys, this week's Doctor's Note, as you know, was on extracorporeal shockwave therapy. We got into a little bit of that treatment as well as the his wave, which is a use of the extracorporeal shockwave therapy. Ernie, I'll start with you. Can you just kind of explain to us what this is? What is extracorporeal shockwave therapy?
It's kind of it's more of a sound pressure wave, and it's used to help increase blood flow to an injured area. And the ultimate goal is to help with the regeneration of healthy tissue. So a lot of times, let's say someone has tendonitis or a chronic inflammatory type of thing, the extracorporeal shockwave therapy is a sound pulse wave that goes in there, and it helps break up scar tissue, kind of helps increase blood flow to that area. And of course, that's what brings the oxygen and nutrition to the area. And that helps regenerate some healthy cells. And that's, like one of the main reasons you use it for is to kind of help get that healing effect in there. And it's good for, especially chronic type things that just are, have slowly gotten versus goes on, and that increased blood flow. Sometimes you get a little scar tissue built up in there. So,
is this something that you can target? So, like, say you mentioned an injured area. Is this sort of therapy something that can get very targeted?
Yes. It's like you're using a sound head, and where you place the sound head is where the energy is going. And the energy is measured in megajoules, and then you also have a frequency in hertz, and you do so many pulses per diagnostic condition. So the sound head allows you to kind of target the tissue in there, and then as far as the energy level, as far as how deep the tissue is, like the energy is measured in megajoules or bars. So if you want to go 1 centimeter below the skin, that would be 60 megajoules. If you want to go 2 bars, which would be 90, or 3 bars, which would be 120. So you can kind of pick the depth of tissue, how much you want energy you deliver to that area. So.
Ernie, we had some internet problems there for just about 10 seconds. Could you say that one more time, just about how that energy is delivered to the injured area?
On the energy, you have a sound head that you place over the injured area. And so the pulses are coming through the sound head. So if you're going to target a specific area, you would concentrate the sound head over that area. And of course, the energy is, it's measured in megajoules or bars of pressure. Like 1 bar will penetrate 1 centimeter of tissue. 2 bars would be 2 centimeters of tissue, and 3 bars would be 3 centimeters. So it depends on the depth of tissue. If you're in an area that has a lot of mass, then you'd have to use a little higher dose. So, and then of course you pick your hertz, which is your frequency. So it's a combination of those two, the energy, the megajoules, and then the hertz. And so that's where you get the energy exchange. But the ultimate goal is just to get the increased blood flow to that area, break up some scar tissue, and then get that healing response, that regeneration of healthy tissue. And that's kind of what you're doing. So
now I want to get Katie involved here, and I want to ask Katie, like, of what Ernie just said, how many of the patients that you see actually understand that? Because that
none.
I'm not even sure I know what a megajoule is, Ernie. But Katie, so go ahead, Ernie. Explain megajoule one more time.
No, I think on the energy thing, it's really not that important. It just, like the technical side of it, a lot of people will ask, well, how does it do that? But it's just the energy that you're putting through the sound head, and that energy is what causes the blood flow to go to the area. A lot of times you get bogged down in all the mechanics of it, but really it's just to help, use the sound head to direct that energy to where you want it. And then the intensity of it is the target tissue, however deep it is or whatever. So that's the easier way to think of it, I think, maybe.
Now, Katie, of what Ernie just said, what sort of questions are you hearing in the office from patients who are interested in this sort of treatment? What sort of phone calls are you guys getting?
Well, the number one question is always, does it work? Can you guarantee it? That's always the number one question. And we've done probably around 45 to 50 treatments since we had the HisWave in the office. And I can successfully say we've never had a disappointed patient after their series of 6 treatments. I've had a couple dissatisfaction with, they didn't want to do the 6 treatments. You usually aren't going to see any bit of a result till that 3rd or 4th treatment you're going to receive, and you get a total of 6. I've had patients that's had prostate cancer that's actually had some success with being able to get an erection again where they haven't for many years, and different things like that. But we've never had one patient come and say, hey, this didn't work for me, I don't understand why it didn't work for me. They've always been, in almost every ending case, as happy as they could be with choosing to do the 6 treatments.
So Katie, you mentioned there is 6 treatments to the HisWave therapy, and you're saying that most people aren't seeing results till the 4th treatment, roundabout 4th. Is that what you're saying?
Right around that 3rd. The 1st and 2nd one, I don't have hardly any people say, hey, I see a difference. I was able to get an erection in the morning, where I haven't been in a couple years. But I did have, I actually just got done doing a HisWave treatment this afternoon. It was his 2nd treatment this afternoon, and he had actually saw a difference the following day from his treatment. That doesn't happen as often, but he was always like, he was already happy as could be, glad he went ahead and got the 6 treatments, and he was excited to see where the next 4 were going to take him. But usually it's the number, when you want to do 2 a week for 3 weeks, and usually it's that 2nd week on that 3rd one they come back to get their 4th one, and they're like, man, this is really working, this is great. And so they're, and by that 6th one, they are always happy. Sometimes I'll have patients that follow up monthly, every 3 months, and I have some that do 1 treatment every 6 months. It really just depends on your age, the severity of your erectile dysfunction, and different things like that.
So you're saying after they've done the 6 treatments, they also will come back for follow-up every 6 months, or are you just talking about different sorts of sequences?
The best thing to do is follow up. We always recommend at 3 months, if not sooner. Some of our older patients like to come in once a month. It really helps them stay where they got with the HisWave. But I'm seeing most commonly about every 6 months, the patients just want to come in. It's kind of like to refresh, make sure everything's kind of like restarting over, like we do with every, different things. It's not going to last forever is another question I get. It's always best to do a follow-up. Some patients in the older age kind of follow up once a year with another 6 treatment and have really good success with that as well. It just depends on the type of erectile dysfunction you have. You could moderately have some, mildly have some, and then that extreme ED, you definitely want to follow up, do your 6 treatments, and then every 3 months come in for just 1, and then keep it that way. And then you don't have to do the, every 6 months, the 6 treatments again.
Ernie,
what way I've seen work.
what Katie's been talking about is his wave, which is the use of extracorporeal shockwave therapy for erectile dysfunction. Ernie, why don't you talk to us a little bit about some of the other treatments that we use this sort of therapy for?
Okay. So the other thing that we use it a lot for is more like a musculoskeletal type of condition. Things like plantar fasciitis, extensor tendonitis of the elbow, golfer's elbow. We've used it for rotator cuff tendonitis in the shoulder. Also use it for Achilles tendonitis and iliotibial band syndrome. And any musculoskeletal condition that where you have some inflammation and maybe you're having a hard time healing the area, and especially if it's a chronic kind of type of thing. A lot of times something will start off as a tendonitis, and then when it gets to be chronic, your body starts to lay down some scar tissue in the area, and then that actually causes that tissue to degenerate. And so really, it's really not healing, it's actually degenerating, and the tissue's not healthy. And the thing with his wave or the extracorporeal shockwave therapy, what it does is get in there and help get blood flow in there to that tissue and actually remodel it. There's top 1 and top 2 collagen fibers in there. It helps remodel that and get the oxygen and nutrition in there. So it's been really good for, I think the FDA approved it for plantar fasciitis in 2000, and I think it was approved by the FDA for extensor tendonitis for the elbow in 2002. So, but we've used it a lot and really got some good results with it, and especially for people that have maybe had some chronic things, even some of the hamstring strains and things like that too, that are always challenging.
That's really interesting. One thing that Dr. Rogers mentions in the note is this circulation as that being like the main thing this thing does. And Katie, I want to know, just from a patient standpoint, what you're hearing. Is that being talked about much in the office from patients? Do they realize if things are a circulation problem or not?
It's about 50-50, honestly. A lot of people just take what Dr. Rogers says about the his wave, and they're like, yeah, sign me up for that. But they know, what it's doing. They understand that there's some plaque buildup. You want to break that plaque up, help new blood vessels flow. And of course, they know that with blood flow, they're going to get a better erection, different things like that. But as far as the circulation goes, not necessarily, it's not one of those big heavy hitter words used about it with a patient.
Well, and I want to stick with you, Katie. Let's just go over some of the frequently asked questions you guys are getting about the his wave in particular. I want to make sure we cover that on this podcast for our listeners now. What are some of the most frequent asked questions you're getting on the phone or people in office when Ernie's recommending this treatment or Dr. Rogers is?
So it's, how long does it take? And that is, again, it's 3 weeks, 2 treatments a week. You want to space them out, usually like a Monday and Friday, a Tuesday or Thursday. Really just depends on your schedule. But you don't want to do them 2 days in a row. They take about 15-20 minutes tops. It doesn't take much time at all. We do about anywhere between 13,000 and 15 shocks to the penis area. And then a lot of people ask, does it work? That's a common one. And I explained that earlier. We haven't had a dissatisfied patient yet. It does work. And then another question is we get asked a lot is, well, who does the treatments? So you have 2 options. You can have a female or a male. It's about 50-50. Some males would rather have a male. Some males would rather have a female. They're just more comfortable. It's totally your choice. We let you make that choice. We do ask that most of all the patients that do the his wave do 6 treatments. That's a common question. Do you have to do 6? Can I do 1? Can I do 2? Can I see? And you do get a better deal, of course, if you buy the 6. For 6 treatments, it's $1,500. And it lasts. Oh, that's another, really big. How long does it last? Well, each patient is different because each patient is going to have a different scale on the ED scale. And there's severe, moderate, or mild. And so if you're mild, you're going to get a year out of your 6 treatments. If you're moderate, if you're mild, you'll get 6 months, and then you want to do a treatment. And then that severe range, you really want to come in, get your 6 treatments, and then follow up once a month, and then maybe do another series of 6 sometime in a year, just to keep up with what you're doing, because plaque is going to build up again, just like it would anywhere. So if you keep that plaque broken up, you're going to be better with how your treatment lasts.
And I want to ask Ernie here in just a second about the plaque buildup. But first, Katie, you just mentioned that there is a scale: mild, moderate, severe. How are we testing for that? Is that something that a patient can tell you, or is that something that we as a practice are testing?
So if you sign up to do a 6 treatment of his wave, we ask you, it's called a shim test. So the person that you sit down with to start your his wave treatments with will ask you a series of 6 questions. And depending on how you answer those 6 questions, there's a scale. So you add it up, and I'm pretty sure it's like 1 to 7 if you rate it is, on the mild side. And then 7 to 14 is moderate. And then anything between 14 and I think 20-ish is on the severe. And that's how you choose your treatment. Do you aggressively treat? Do you moderately treat that area, or do you lightly treat that area? Because each patient is different, of course, and like everything we do. So we treat each patient differently, and each patient gets a different amount of shocks depending on that shim test that you take. We usually have you take it on the first one and the last one to see, how's it going. And then during your treatments in between, the technician that's doing your his wave is going to ask, hey, have you seen a difference? I usually try to start asking, the patient, well, you saw any difference? And they're usually, they're like, yeah, or yes, this is great, different things like that, depending on where you're at. And then you'll just, document that. And then at the end, you'll take another test to see how well it worked for them. And we also try to get the patient. Yeah, sorry.
No, that's fine. Keep going. I was going to ask it's called a shim test.
Yeah.
Okay.
And that's just that's what we originally got taught to do. So we just carried that on. We tailored the questions to what people tell us. So it's kind of like this performance medicine test to see how is your ED, where do you stand with your ED, and different things like that. It's different for every age group. I mean, we've had patients that are in their early 30s that come in, or up into their 80s that come in for this. So we have a very wide variety, and we kind of just put the questions together to see, for each different age group that it would, question would hit them, and then it might alter their treatment a little bit different. But we do, we try to get the patient, there's a few different things you want to do. Like if you're on that severe end of ED, we try, the protocol is that you take 10 milligrams of a daily Cialis, not daily, but every other day for 3 weeks while you're doing this. And then once you get past that 3 weeks, we try to get you to do a 5 milligram Cialis every day, just to help different things. BPH, of course, is, Dr. Rogers' number one, but that also helps the circulation and helps with your ED, and just helps his wave do even better for you. When you're on that moderate, we try to say, hey, just do 5 milligrams every other day, see how that does for you. And then back to the severe one, a lot of times if you have severe ED, sometimes that his wave isn't going to be right on the hand. It's not going to hit it for you. And so we try to do like a protocol where you use a penis pump every day, 2 times a day, 3-week period. And that seems to really help the patients that are on the severe range of ED. And then, some will even do the PRP shot with it. That will really help. That helps new growth cells. It helps patients get a little bit more out of their his wave, and together that it makes a huge difference in our patients with severe ED. I'd say about half of our patients that's done the his wave has gotten that P shot, just to make it really worth their while and their money to do that and add that on.
That is really interesting. And Ernie, I want to ask you, she mentioned the his wave in combination with PRP. Can you explain for our listeners how those two work together, and how a P shot might make the his wave work better? Did you hear me, Ernie? Am I breaking up here?
Okay. On his way, the purpose of it. I see. Are you there?
It
I'm
looks
sorry,
like
Ben. I must got
our
cut off or
internet's
something there. Sorry.
now
Yeah.
you're good. Now you're good. You're good.
Okay. Uh, on the like the PRP shot, it's the platelet-rich plasma, and and of course the platelets have the growth factor. So after you've done the his wave, you're trying to get that blood flow in there, trying to get the metabolism of the tissue there to get the blood flow in, try to get some healing in there. And then by doing the P shot or the PRP shot, the platelets have the growth factor, so that helps stimulate the tissue even more. So it just sort of accelerates that and gives you, because the platelets have the growth factor, and that just sort of really supercharges it. Is what you're doing there, is to get that little extra in there. It sort of takes advantage of after you've done the his way therapy there, then the PRP just adds that healing response to it even more. So the two go together well.
That's interesting, and I wanted to ask you again, Ernie, about the plaque buildup. Katie mentioned that plaque buildup can come back. Is that what you're seeing, even with the other treatments in the other injured areas, or is that just with erectile dysfunction?
Yeah, it's kind of like, I think, with the ED, the tissue is kind of a spongy top tissue that, where blood flow is in there. So, and you have a lot of arteries in there. And of course, arteries are like anything else in our body. As we age, we tend to get a little plaque buildup, or we don't get as good a blood flow through there. So, it's a little different, I think, in the musculoskeletal realm. Like if you have a tendonitis or something, it's usually you're dealing with tendons and ligaments, and of course those don't have as much, they don't have any capillaries as, say, like muscle belly itself. So but where most of the tendinitises occur is where the tendon inserts in the bone, which is sort of there's less blood, there's less blood supply there to start with. So when you get a tendinitis here, it's a little different. It's more to sort of get that collagen to remodel itself in there, get that blood flow in and the oxygen in, so you get the remodeling. Where I think with ED, it's a little different tissue that you're dealing with, but because it's more of a spongy type tissue that where the blood flow is coming in there, and but that's kind of where the arteries get that little bit of plaque buildup, and so you're getting that. It changes the metabolic part of that for things, and get you get you get that increased blood in, so it's a little bit different, but it's still, the same principle, I think.
This is a little random, but you've mentioned tendonitis quite a bit. Is tendonitis just lack of blood flow or lack of circulation? I think we might have had an internet issue. Say that one more time, Ernie. We broke up there. We're going through a storm here in the Tri-Cities.
Yeah.
Ernie,
I missed that last little bit you said.
Well, I was asking you just about tendonitis. You've mentioned that a few times. Is that just lack of blood flow or lack of circulation?
No, the tendonitis is kind of it's more of an inflammatory type of thing. The tendonitis, when someone first hurts themselves, or say you go out and run, or you've done an activity and you get some, like say you get tennis elbow, like you've been out playing tennis and you got, the tendonitis there. That's an inflammatory response. And what happens a lot of times is, an athlete will go out and play every day. So if you got some tendonitis, and by the next day it's really not healed, so you go out and play again, and then over and over and over. So you get that inflammatory response, and then your body starts to lay down some collagen in there to heal that tissue. But what happens over time, it starts to scar down a little bit, and then you don't really get the blood flow in there. So it gets to be a chronic type thing. So most tendonitis initially is just an inflammatory type thing. You try to use ice and use the anti-inflammatory, that type of thing, the NSAIDs and stuff. But what happens a lot of times, if you have chronic, if it's a chronic inflammatory type of thing, then your body starts laying down some extra collagen, sometimes some calcium even in that area. So That's where, the his wave really helps to get in there and sort of break some of that up and sort of get that blood flow in there and get some new tissue, some healthy tissue in there. But
thank you for that, and guys, we're gonna have to wrap up here. So I'm gonna do some final thoughts, and I want to start with Katie here. We're gonna do final thoughts on this note on extracorporeal shockwave therapy, and Katie, specifically for you, is there any message you want to get out to patients, either potential patients or current patients who are listening now? Any information or anything you took from this note that you feel they need to know?
Not really, just if they do have any questions, they can call the Kingsport office and ask to speak to me or Ernie. You can ask us any question. No question is crazy. We've been asked them all through this. There's no crazy question with this. We're always just, call and say, hey, I just want to talk to Katie or Ernie about the his wave, or set up an appointment, and we can do it either way, anytime. We'll try to, answer every question we can to the best of our ability.
Well, thank you, Katie. And Ernie, is there any final thoughts you have on this treatment, whether for erectile dysfunction with the his wave or for some of the injured areas that you do as a physical therapist?
I would say if anybody has any chronic problems, especially with tendonitis, I see a lot of hip pain. People have bursitis, IT band syndrome, Achilles tendonitis, hamstring strains, those type of things. Those really respond well to this. So, especially if you've had a problem that's been kind of a chronic problem, if it's an acute type of thing, usually you can ice it and take some anti-inflammatories, and it usually does well. But if you've had some chronic issues and just not getting better, I'd encourage anybody to maybe try or think about this anyhow. I think it really works, and we've seen some good results with that.
Well, guys, I tell you, I could talk all day with you guys about this sort of thing, and I just want to first thank you for being here, and it's been a really long day. I know you guys have been in the office all day long, so thank you guys. Katie, thank you so much for being here, and Ernie, thank you for being here. Will you guys both promise me you'll get back on the show with me, and we'll rap about some other cool topic that we're doing, or some cool therapy we're doing in the office? You got to promise me right now.
We'll think about it.
Sure, I will.
All right.
Thank you very much for having us on.
All right, guys. Thank you
very much.
Thank you so much. Thank you guys for listening. And and as always, we will see you guys next time on the Mid-Level Show.
Okay. Thanks so much.